Hi, I'm Ben Ponder, and I'm back again for another installment of our discussion on healthcare reform. The, uh, the next phase of this, I'd like to talk a little bit about the problems as I see them. And those, I think it's important that we begin with the stories that we hear and that we know from personal experience. Maybe it's your own story or my own story. Maybe it's a loved one. But somebody out there has run into difficulty in their lives. Somebody probably really close to you, and maybe that has produced financial hardship. Maybe it's ended up being difficult for their marriage or any number of other situations. But I think what we've got to take two steps back from the really, in many cases, powerful and moving stories, and realize that we could, if we really wanted to pick out a handful of those, we could do a lot of good and solve 5, 10, who knows how many of these situations, and say, oh, that was wrong, that obviously shouldn't have happened that way. But when we're talking about government, when we're talking about, on this federal level, healthcare reform, we're really talking about something that's even broader than those individual stories. And we're talking about a problem that's really systemic. It's not just a case-by-case problem. It's a systemic problem. Each of those cases is symptomatic in a lot of ways of deeper problems that the system is just going to keep churning out these heartbreaking stories. And so, until we solve the systemic problems facing our healthcare system, we can't be surprised if we continue to encounter loved ones and friends and family who have these really difficult and terrible situations. So, what I want to try to talk about is the system, and how do we fix the system? Because once we fix the system, then a lot of these cases will get a lot better. And I think one of the things that we have to do before we proceed too quickly is to start talking about the problem. And that's where, again, I think one of the pitfalls of the debate as it's proceeded is that we have rushed to solutions, and many of them are good solutions, and believe me, I understand the political pressure and the other pressures at work to expedite solutions and to get there quickly. And so know that I'm highly aware of all the constraints. But what we've seen in our country, and specifically with our healthcare system of late, these are some of the problems that I think we've seen that I've identified, at least. We have too many working Americans who are getting low quality health care, or maybe no health care at all, because they're unable to afford it. And that, again, like I talked about before, is one of the great strengths of the health care law that has been that's just been signed into law. Which even has the word affordable in its title, and so that's one of the problems, and it's one that we have I think begun to address as a country. A second problem is that we have too many healthcare practitioners and facilities who are providing low quality, high cost care to patients because of perverse economic incentives that require physicians to mow through their patient load so quickly that they don't have the time to actually listen to the patients, to understand the symptoms, the conditions, and the life situations that may have produced whatever chronic or acute situation that patient's in. And instead, those physicians and other healthcare practitioners are paid to run really expensive tests and procedures. So if you come in with a sinus, a bit of a sinus infection, a doctor could just sit down and talk to you for a minute and really understand. Oh, I think he or she has a just a low-grade sinus infection, we'll give you some, if it's antibiotics or whatever else, and come back and see me, and we'll make sure everything's okay. Or, and now in that first scenario, they made whatever their pretty basic rate is for a clinic visit. It's not as much as you might think. That's the first scenario. The second scenario is, well, let's do a CT scan of your nasal passages and make sure that everything's working right there and that kind of thing, which may be several hundreds of dollars. And sure, it's good information. It can't hurt to have a CT scan, can it? And certainly if if the doctor's not paying for it out of his or her own pocket and the patient's not necessarily paying for it, then why not? And that's, again, one of these examples of the system is set up so that insurance companies simply pay a lot more for that particular kind of practice of medicine. Another problem is that prescription drug costs are simply too high for working Americans and retirees to afford, and we'll talk about that more in a few minutes. Another problem, Americans have lost ownership, a personal stake in our own health care. And then, something we'll also talk about is how we can balance taking care of patients who may or may not have suffered at the hands of some healthcare practitioner, and at the same time not wrongly encourage our doctors to practice defensive medicine, which leads to a lot of waste and leads to a whole bunch of money being spent in courtrooms that doesn't have to be spent. And so I'll just wrap this one up with that, and we'll move on and get specific on some of my solutions in the next video.